Good afternoon. For our teaching presentation, Janessa and I have decided to educate about Down syndrome to an expectant mother. We have identified some of the major topics that mothers want to know when they find out they will have a child with Down syndrome. Some of these topics are: what is Down syndrome? How do you get it? How common is it? Some of the complications and life expectancy, as well as treatment and local community resources here in Miami available not only for the parents but also for the child once he or she is born and throughout their life. Down syndrome is a congenital chromosomal defect where there is an extra pair of chromosome 21. It is also called trisomy 21. This additional chromosome alters the development and causes different characteristics associated with Down syndrome. Those with Down syndrome are often born with other birth defects, have a cognitive delay, and intellectual disability. It has also been reported that children with Down syndrome experience developmental delays and behavioral problems. There are three different types of Down syndrome. However, they are similar in behavior and physical features. The first type and the most common one is called trisomy 21. In this type, each cell in the body of the affected person has three separate copies of chromosome 21 when there are usually just two pairs. Trisomy 21 accounts for 95% of people with Down syndrome. The second type is called translocation Down syndrome, in which a part of the whole chromosome 21 attaches to another chromosome instead of being a separate chromosome 21. The third type is the least common one, and it's called mosaic Down syndrome. In this type, there is a combination of chromosomes 21. While some cells may have three copies of chromosome 21, other cells have the regular two pairs of chromosome 21. These children with the mosaic Down syndrome may have fewer characteristics and features of the Down syndrome due to the mixture of cells. In the United States, Down syndrome is currently the most common diagnosed chromosomal disorder. Every year, there are more or less 6,000 children born with Down syndrome, which means that 1 in every 700 babies are born with it. One of the most common factors for babies with Down syndrome is the mother's age. Women who are pregnant at or after 35 years of age have a higher chance of having a baby with Down syndrome. Even though there is a higher chance with older women, most of the Down syndrome babies are from younger mothers since they have a higher pregnancy rate. Down syndrome is linked to a vast range of comorbidities during the different stages of life. In early childhood, you can see congenital heart defects, reduced immunological function, and acute lymphocytic leukemia. In adulthood, visual and hearing defects, hypothyroidism, diabetes, dementia, Alzheimer's, and epilepsy. People with Down syndrome are living longer now due to advanced technology than they did a couple of decades ago. More people are interacting with those who have Down syndrome, and it's not only raising awareness but also acceptance. Back in 1910, before the discovery of antibiotics, the life expectancy for those babies born with Down syndrome was to age 9. Nowadays, due to the advanced technology in medicine, about 80% of adults with Down syndrome are reaching age 60 and some live even longer. Some kids with Down syndrome may act and behave the same as other kids. However, they have different capabilities. Some of the more common physical features are a flat face, almond-shaped eyes, a short neck, small ears, a tongue that sticks out of the mouth, tiny white spots on the iris, small hands and feet, a single line across the palm of the hand, small pinky fingers that often curve toward the thumb, poor muscle tone, and shorter in height than children without Down syndrome. Down syndrome is a lifelong condition in which treatment is based on improving the quality of life for these children and have them become successful members of society as adults. Early interventions play an important role in the life of a child with Down syndrome. Some of these therapies include occupational therapy, which aids in the development of fine motor skills such as dressing, grooming, and feeding. Physical therapy, which aids in the development of gross motor skills such as proper foot alignment, good posture, and a good base for exercise through their life. And speech therapy, which aids in learning how to communicate and helps in the progress of speech and language. These are some of the available local resources. The Down Syndrome Association of Miami. It brings awareness to the community as well as provides support and services to families and individuals with Down syndrome. The National Down Syndrome Society. It provides education and support to newly expectant parents and individuals with Down syndrome. Parent to Parent of Miami. This institution provides education, information, and support to parents with special needs children. And also the Special Olympics of Florida. It helps people with disability to become productive and respected members of society through sports participation. This concludes our patient teaching presentation. We hope you have enjoyed it as much as we did. Thank you.